Hey guys, All the Way with Alloway here with Ryan McGarry, the writer, director, filmmaker behind the award-winning documentary Code Black. So because a lot of people haven't seen the film yet, what is the story? What are you exploring here at LA County with all of you residents?
So I think at its heart, Code Black is a visual essay on ideals and letting those ideals potentially be threatened by a system that's bigger than you. And so as a bunch of young physicians, we follow them coming in, literally on some of their first days, and then following them all through their training. All the while, they've come into the American healthcare system with these really strong ideals and expectations of what they think medicine's going to be like, and then the system really gives them a real reality check, and they have to kind of balance those expectations with what they...
Let's backtrack, take it back when you decided to make this film. What was that process like, getting something made where you have a camera in the hospital,
Sure, an especially sleepless approach to first-time filmmaking, I will say, as a resident and medical student. You got to rewind almost 5 years to when I was a medical student here, and I had seen a lot of ERs at that point, just as a rotating student, but when I walked into the old hospital here and seen the absolute insanity and close quarters and perceived chaos of emergency room, I thought, oh my, this is incredible. And then I found out it was going to close right off the bat. I'm like, wait a second, you have this amazing historic place that seems caught in another era that's still functioning, and it's about to be accelerated into the modern era. And there's all these characters and there's all this action. It's definitely a film here.
Yeah.
And so I went for it.
What LA County has that's unique is that you guys do work as a team. And what does the placard say in front of the old LA County? There's we are here for the people.
Yeah, so there's an inscription that was chiseled into the actual limestone entrance over there that says, in summary, that the citizens of Los Angeles basically tax themselves for a decade to ensure that there's an institution like this hospital that will not let any healthcare go restricted to those who need it.
And what I really like in the film is that it doesn't bash the healthcare system and the flaws in the government over your head. It really gives you, a gritty depiction of just a day in the life of you guys. But you say that people should do the right thing ultimately when it comes to healthcare, and that there is that disconnect between what you see and the system.
Yeah, well, I think that working in this environment is very disarming, and I think I wanted the film to have the same effect. I think that it's hard to hold on to politics or real hardcore economic views when ultimately you're just seeing people suffering here and waiting a long time suffering. So, as far as the right thing, I think that for me that's looking at that and experiencing that, and then putting that moment above politics and above economics. After that, it gets complicated, as we all know. But I feel like a lot of times in the rhetoric and the discussion, it's all that exists without that first step of really realizing what goes on here every moment.
And in the film, you talk about trying to figure out what it means to be a doctor in America today. And I'm curious, you had that question while you were making the film. Do you have a different answer to that question now that you've done the film and now that you're graduating?
I'm not sure if it's different. I think that when I started filming, I think I thought that for the most part my role as a physician in this country would be one of scientific and compassion sort of application. And that would be sort of the limited area where I would be expected to function, is really just with the patient, giving them their cure, their treatment, whatever, and then also being their support. And that seemed like a lot, right? That alone seemed like a pretty big thing to be ready for. I think after the film, I didn't expect that, really, particularly in this specialty as emergency room doctor, that we would be this total safety net function, effectively seeing people who could be going to other doctors but just can't get there. And so suddenly we're not only are we emergency room doctors, but we're also primary care doctors, we're family medicine doctors, we're actually sort of filling in for other specialties who, for various reasons, can't be there for that patient.
Right. So what's next for you? So So the film did really well at the festival. What's next for Code Black? When can we see it? What's up next for you as a director?
Cool. So Code Black is right now getting some nibbles for distribution, so that would be sweet. And hopefully we'll have some news about that in the next few days. As a director, looking next to a potential scripted series that's fiction and based on the documentary. It's been optioned by one of our executive producers, and will likely be headed towards premium cable, which would be...
Not Grey's Anatomy.
Not Grey's Anatomy, no.
Better.
Yeah, better. Well, hey, Grey's does a good job, but we feel there's something very powerful about a non-sentimental, very deep sort of drama, realistic, hard-hitting approach to what is effectively those things in real life, you know?
With these patients that are personable.
So sorry, I actually have to take this one.
Yeah.
McGarry, what up, brother? This is a real doctor call. Hey, what's up, man? No surprises, as far as I know, if that's what you mean. Yeah, although for some reason that doesn't sound like my patient, man. I don't think I had a COPD exacerbation. You sure it was under McGarry?